Dr. Adrian Castro. I'm a pediatrician. I went to college at Harvard University on the East Coast. I took a break from education or schooling for a while. I was a high school teacher for approximately 5 years and did Teach for America. And then after Teach for America and teaching at John Muir High School here in Northwest Pasadena, and for 4 years and 4 or 5 years and 1 year at Pasadena High School. Then I did certification at school there. And then for teaching, then I worked at City of Hope doing T-cell immunotherapy for about 2 years. And then I went to USC, Keck School of Medicine for 4 years. Then I did UCLA residency. And then I started my current job, which is at Wisconsin Pediatrics in La Cañada, Flint Ridge, working at a group practice as part of Huntington Health Physicians. And I've been there for about 10 years now. I would say I thought that I should go into medicine when I was in college because my father gave me the options of engineer, lawyer, or physician as probably the only meaningful jobs to ever make a difference in the world. So he was giving me no other options, or at least he felt like that would be the only thing, the most thing that he felt that would be the best that one could do. But when I was in college, I started doing all the stuff I was supposed to do, and then in the middle of it, realized I was doing it not for me. So I took a break and did teaching instead because I hit a point where I said I don't like this. So I instead spent the last 2.5 years doing a lot of fun stuff at college, meaning that interesting stuff, not fun, but just really great. And I ended up with a Bachelor of Arts in biology. So Bachelor of Arts and allowed me to do a bunch of other career things. And so when I did teaching, then of course that was probably a relative disappointment for my father and my family, kind of. But I was okay with that because it's really what I want to do, and I love hanging. I love being with children and teaching children or kids, and I really enjoyed adolescents and kids. So I did that, and then in the middle of that, after I was doing pretty well teaching, I saw that to have a career in education and to make a good living, I would need to move into the administrative world and be away from interactions. And I felt like that wasn't my personality. So then I was bringing in career days and different physicians and scientists into the science classroom that I was teaching. And those doctors were different than the doctors I had met when I was in college, and seemed that they really loved what they were doing. A lot of them. And so since they love what they were doing, I said, let me think about this. And then I started looking back into it. And then I started the career to get back. And so I started medical school at 30. It was a longer path, but then when I was coming into medical school, I really wanted to be there and I worked hard to be there. So that was different than I would have done if I just did it as a result of just going through the motions in college. So pediatricians only are trained to do their 3-year specialization, just working with those from newborn, so day of birth, day of life 0, all the way until they're mostly 21. Sometimes there's exceptions for that, but I would say on average 0 to 21, seeing kids. So making sure that you are aware of the special conditions and the special needs that are different from the adult population. Family medicine would be maybe covering people from all of their life, and internal medicine or adult docs cover those above 21 only, and then some geriatricians will see only the older population. So this is mostly a subspecialization focused on children 0 to about 21. So since I'm in an outpatient clinic, I am in, we could talk a little bit of pre-COVID and post-COVID, but in my routine pre-COVID times, it was usually a mix of urgent care, meaning that I come into the same office every day during the week, and I see patients. Usually pre-COVID, it was a mix of ill visits mixed in with physical exams. With children, as we mentioned, I could walk into and see a newborn and then the next room could be a 19-year-old, and then the next one could be a 4-year-old. And so a routine for me is usually mix of seeing sick visits mixed in with well visits. And that would be somewhere in the range of maybe 20 patients, 16 to 20 patients a day, depending on how many physicals you had and how many ill visits you had, since you might have different time slots for each of those. Post-COVID, once COVID hit in, we changed a lot, and we are only seeing throughout the most of the day well visits, and then a little bit of sick visits towards the end of the day, since most people have been quarantined and not accessible, so less illnesses during this time. The kids, I mean, all the kids from all the range. I mean, love babies, love little ones, little kids. I would say that I love all kids, and I find them all challenging and special in their own way. But I would say that I really love the 3 to 5-year-old kids. That just happens to be because I find them being super imaginative and creative and fun, and they're talking, and you ask them what they're going to be when they grow up, and it comes from I want to be big to I want to be, I want to be a fairy, or I want to be a princess, or I want to be a rocket ship. I mean, the mind is just so open and fun and creative. So I think that dealing with those to begin with, and then having the ability to form relationships with families, and in the rare occasions, which doesn't happen commonly, but happens enough where there's something more significant or harmful that a family needs to go through in terms of medical outcomes, that I can be there to walk a family through some tough situations, and help them to understand, because medicine can be very complicated, and it can be explained poorly, and it can be scary for families. So I think having a trusted medical person that you can have for your child's family, or child's life, is very comforting to many families. And I think that I can provide that comfort in what can be very challenging. And then also helping to make sure I help kids go on the right path in terms of overall health and wellness. I think the hardest thing is probably the most challenging thing. I don't know if there's most, but I would say a couple challenges would be if you see having sick kids. I think that's a very sick kids. It's hard to watch kids get really sick, but because families can be very concerned and anxiety can go up. But again, I can flip that and be there and be a nice presence. Sometimes I think the challenges with my position would be we are at a group practice, so that means I sometimes will see families that don't know me very well. So it's harder to gain confidence and trust in a family when you may be covering for your partner. And so there could be a very sick patient or a very concerned parent, and they've seen another physician in the practice for 2 years, 5 years, 8 years, and you come in and gaining that trust and relationship. That's challenging. I think that's hard. It's pretty easy if you know them, but that's a challenge to me. And I think the only other challenging thing would be sometimes, parents are all different types. I don't ever think I have a problem interacting with kids and the children, but sometimes parents can be challenging for a variety of reasons, whether their lives are challenging or they have a different way of seeing things, or their families are challenging. Personalities can be different. So luckily, most of the time you can find ways to connect, but that can be also just a challenge that needs to be worked with. Most of the families we see are just wonderful, and I'm grateful, and the parents are just awesome. There's a mandated. Are you saying like what are they mandating us to do, or what do I do to keep current? That's not mandated, or both.
Well, it's mandated, but you have sort of like a lot of freedom and flexibility to choose what you do, right?
Yeah, but there's a lot of things that aren't mandated that I do anyway. So I'm somebody who thinks that I since I enjoy my practice, like for example, like ways to stay current. That's what I was asking. Like there's a newsletter that comes out monthly that's called the AAP News, for example, and I don't get credit for it. Nobody tells me to do it, but that's one way is to keep. There's specific news sources that tell you the up to date summaries of that. There's also emails, briefs that come in with the news, what's coming in. When there's big topics like COVID, like I read that almost constantly every day or every couple days in all of the big news lines to know what parents know and what's out there. So those are things that are doing that, again, non-mandated. There are talks all the time. So I think I'm somebody who likes to be aware. So right now during COVID, there's about once a month, there's a COVID talk that you have access to. There are conferences. I was going to a lot more, probably 2 or 3 a year. Again, non-mandated, but something that I found interesting. Children's Hospital Los Angeles has Saturday conferences. The American Academy of Pediatrics California division has a yearly conference as well. And then there's the national conference, which happens, and I try to go to as well when I can, when it's nearby. That's a 3 or 4 day. I think conferences, articles, and keeping up with any webinars, and then our office will sometimes have webinars as well, or meetings once a week during our Monday meetings that we have for the physicians in the office. So I think in the most recent ones has been a dermatologist, a pulmonologist. So we have to. I mean, I feel like learning is it's constant, and it's good. I would be bored if this was a stagnant career in which I knew it all. I feel like I'm learning all the time still. I think fortunately or unfortunately, pediatrics, general practice, and so we're dealing with kids. I think the limitations that we have are directly related to the system that supports this. And so what I mean by that is the medical system, so health insurance and the government that pays for that, or the government that maintains that. So I think that the limitations to our practice, I personally would love if pediatrics and general care could lean and change the mode of thinking from sick care to well care, and to be supportive and to provide interactions and to not compensate, which currently we have. The compensation is focused on, the way the insurance companies work, and the way that government has set things up is to compensate those who do procedures and do things to you and who take care of you when you're sick. I would love if there was a shift towards, which there's been a slight shift, but more and more towards a preventative medicine and interactions and relationships buildings, and helping to educate and be part of family lives and kids' lives in a way that will keep them from getting ill, and minimize having to use hospital and medical resources. But right now, that's not compensated very well. So it's hard to, spend your time trying to be part of families. And we still do it, but it's just hard to do it well when we're not compensated, and we're instead a source of we're sick care. So I think that obviously you need that as well. But I think that I hope that the future of medicine, if done well, but these are policies that are way outside my realm. I hope policies will lean towards more universal care, universal systems that allow EHRs to talk to each other, electronic health records. I would love a universal healthcare system that would allow us to really get information that will allow us to care better for preventing illness in my patients. High schoolers, correct? You're saying 16, 17-year-olds? Year-olds?
I think also maybe college students. I'm not sure.
Yeah, so I guess the reason why I'm saying that is because it kind of depends. Because if you're a high schooler, my advice, if you want to be in medicine, is make sure you know it's for you. If this is part of what you're doing for yourself, is learn about what a career is, learn about what the day in and out, and make sure you're doing it for the right reasons for you. General practice at the moment, like I wouldn't do it from if you're a person who's going to do excellent in college and have many opportunities for you. Don't do it for the money, like an image. Don't do it for, well, doctors make money, or because my parents are going to be happy, or because my community, or whatever. I think because for whatever the tag, or for those kinds of the name. I think if you're going to do it, it should be because it's something that, number one, interests you, and number two, fits your lifestyle, what you see as a lifestyle, and then number three, what you see as that you'll be in for. Because there are people who drop out, there are people who aren't happy with it, and most of the people who do is because I think that they haven't spent the time to ask the question, why Am I doing it? And is this make me happy? And would doing that every single day for many years, like not just I can do it, but you should think about, and so I think that I would advise high school students to make sure you're exploring in high school and then also in college, look at things, connect with things, do internships, make sure that you have looked at things because you don't want to have to change mid career. So I'd recommend to look at that and think hard about checking what you're doing and not having an idealized image of what medicine is or what a doctor does. Have a true idea of it and see if it really drives you inside versus anything else.